Welcome to this webinar on healthy weight support across the life course, during which you will hear about the healthy weight support available from NHSGGC, covering activities for citizens of all ages. This session is brought to you by the Glasgow Food Policy Partnership and is supported by the Glasgow Centre for Population Health Communications team. I am Lorna Hamilton, a state registered dietitian within the role as a health improvement lead for healthy weight, physical activity and public health nutrition at NHS Greater Glasgow and Clyde. And I'm delighted to welcome you to our webinar on healthy weight support across the life course. Before we begin, just a few housekeeping notes. The webinar will run for approximately 1 hour and 30 minutes. During this session, you will hear presentations about a number of health improvement programmes and healthy weight initiatives delivered by different NHSGGC teams and their partners. This presentation will be followed by a panel question and answer session. Please see our agenda today. As you can see, we will provide you with a full overview for all our healthy weight programmes. In order to keep to time, we will provide you with an overview of the expertise and the experience of each speaker within the chat function at the start of each presentation. Before we hear from our speakers today, I would like to highlight both Scotland's Population Health Framework and the Good Food Nation Act, which both reinforce the importance of a whole system approach to diet, physical activity and health equity. Scotland's Population Health Framework is a 10-year strategic framework co-developed by the Scottish Government and COSLA. It aims to improve Scotland's overall health and reduce life expectancy gap between the most deprived 20% and the national average. It promotes cross-sectional collaboration with a strong emphasis on prevention and tackling the social determinants of health. The Scottish Government Good Food Nation Act 2022 mandates that Scottish ministers, health boards and local authorities must each produce a Good Food Nation plan. These plans must outline outcomes, policies and indicators related to food and health. The Good Food Nation Act provides a legislative lever to embed nutrition into local planning, social prescribing and community development. The Population Health Framework prioritises healthy weight as a key outcome. Before we introduce our first speaker today, I'd like to quickly set the scene. The population overweight and obesity is a continuing challenge, and as you can see from this infographic, prevalence increases across the life course. This slide emphasises the importance of NHSGGC's commitment to our healthy weight programmes. In terms of our ambition to positively influence the health impact that overweight and obesity has as a risk factor for the development of many health conditions for our citizens. To address this risk, the NHSGGC Healthy Weight programmes takes a life course approach, with programmes and activities aimed at early years in families, young people, adults and those either pre-diabetic or newly diagnosed. I want to emphasise in this slide that NHSGGC aims to ensure that no matter what stage of the life course a citizen is, we ensure that there is a seamless transition between all of our healthy weight programmes. We created this diagram to help articulate the full range of healthy weight support across the life course available by NHSGGC and our partners. Over the course of the presentation today, you will get to meet and hear from members of each team. We're now going to move to the first of our presentations today. Therefore, I would like to introduce our first speaker, Mary McLachlan, who will take us through the role of breastfeeding support in the context of healthy weight.
My name is Mary McLachlan. I'm a Health Improvement Senior in the North East Health Improvement team. So I'm just going to dive right in here with a brief look at the policy context with regards to breastfeeding and child healthy weight. So in 2018, the Scottish Government published a Healthier Future, Scotland's Healthy Weight Delivery Plan, in which it stated there's strong evidence that breastfeeding is one of the most important things that a mother can do to give her baby the best nutritional start in life, and can also be a means of preventing obesity among infants and young children. And on the back of that, all health boards nationally were given the aim to reduce drop-off in breastfeeding at 6 to 8 weeks by 10% by 2025. And I'm pleased to say that across GGC as a whole and also within Glasgow City, we have managed to do that. The population health framework that Lorna mentioned came out earlier this year, and it is really prevention focused with a strong emphasis on the early years, and really breastfeeding success underpins that. And then just looking at some of the breastfeeding rates currently. So this graph shows you the percentage of babies exclusively breastfed at 6 to 8 weeks. And if you look at the light blue line, and the purple line is right behind it. So light blue is GGC and the purple line is Glasgow City. So the trend of both those really mirror each other. And we're sitting currently at about 30.2% for GGC in Glasgow City, which is a couple of percentage points lower than the national average. But what I really wanted to highlight as well in this graph is that there are huge disparities between the most affluent areas where breastfeeding rates are much higher, and then the more deprived areas of the city. So I've just taken a couple of neighbourhoods in northwest Glasgow. So you see the green line at the top is Partick Hill and Hindland, and then Drumchapel North at the bottom there. And there's a big gap between those. But the good news is that although there is still a big gap, we're working on that, and the gap is narrowing. So what is the relationship between breastfeeding and overweight or obesity? So there is a huge amount of robust evidence showing that there are clear short and long-term benefits to breastfeeding for both the infant and the breastfeeding parent. And one of these is that breastfeeding is associated with a decreased risk of obesity from early childhood through to adolescence. And research suggests that this decreased risk is around 25%. Breastfeeding also reduces the risk of metabolic disorders such as type 2 diabetes. And we know with breastfeeding that a dose-dependent effect is observed. So basically, the more exclusively and the longer that children are breastfed for, the greater their protection from obesity. So how does this happen? What are the mechanisms behind this? Well, if we look at the first one there, breastfeeding is associated with appetite regulation. So there are two components to this, really. The first one is that a breastfed baby is more likely to be able to self-regulate their intake. So basically they build their hunger satiety cue recognition. So in other words, breastfed babies are more likely to know when they're full and when they're hungry in comparison to formula-fed babies. And then the second component of that first point there is that breast milk also contains hormones such as leptin, and leptin is the satiety hormone, so it tells us when we're full. Then the second point there, research suggests that formula consumption causes a greater insulin response, which can in turn lead to fat deposition in the body. And then lastly, breastfeeding may influence the development of a healthy gut microbiota. So we know that affects how the body extracts energy from food and how the body stores fat. So breast milk is rich in bifidobacteria, for example, which have been shown to be present in a lesser extent in the gut of obese children. So really there's enough evidence to show that breastfeeding support and promotion has long-term consequences on the prevalence of overweight and obesity, and really that it's a powerful public health tool. And it can also be used massively to level up all the health inequalities in the early years period because of this and all the other health benefits. So moving on to look at the support that's offered around breastfeeding across GGC. So I just wanted to mention, first of all, the UNICEF Baby Friendly Initiative. So that's a global scheme from WHO and UNICEF, and it aims to improve standards of care within healthcare settings. So across GGC, all maternity services, neonatal units, and community or health visiting services are UNICEF Baby Friendly accredited. So right from when a woman becomes pregnant in GGC, there are lots of different resources and contacts she will receive throughout her pregnancy to support feeding choices. So in terms of maternity services, a woman will have lots of visits with appointments with her midwife in which she can explore her feeding choices, and will also be offered antenatal classes. These will have a breastfeeding focus, and there may also be even a standalone breastfeeding class. As part of the universal pathway, a health visitor will also provide a contact at a home visit at 32 to 34 weeks. And this is a further opportunity to explore feeding options as well. And then lastly, once baby is born, midwives will encourage and support new mums wherever possible, as long as everything is okay with mum and baby, to have skin-to-skin contact for their baby, and things like weighing and measuring will be delayed, so they have that protected golden hour of skin-to-skin, and that encourages the bonding with mum and baby, and also really encourages the establishment of breastfeeding. And the protected golden hour is an example of one of the UNICEF baby-friendly standards. Next slide, please. Thank you. So from 10 to 14 days, the care of a baby is passed from maternity services to the health visiting services. So from this point, the main point of contact for families, if they have any breastfeeding issues, would be their health visitor or family nurse. But we also have lots of elements in place to augment this universal pathway. One of these is a community breast pump loan scheme, where families can access an electric breast pump through their health visitor or their family nurse. We also have a breastfeeding problem-solving clinic, which is run by our specialist infant feeding advisors, and that's for more complex breastfeeding issues. If there's any weight faltering issues, ongoing position attachment, or lactating issues. And then we have a frenotomy or tongue tie clinic. So we know that sometimes tongue tie can impede successful breastfeeding. So we have a tongue tie clinic. The availability of appointments has recently been doubled when the service was reviewed. And so waiting times for this are about 1 to 2 weeks currently. And then finally, we have the lovely, wonderful Milk Bank Scotland, which provides human milk to babies who have no or limited access to their mum's own milk. So donated human milk is really valuable for babies who are premature, very small, or if they're sick when they're born. We also provide support in local communities. So we work with the breastfeeding network across GGC to facilitate breastfeeding support groups. And so families can access support there from volunteers or staff from the breastfeeding network, but they can also just come together with other mums from their local community and have a cup of tea and have a chat. So that, yeah, they're really, really popular. Incidentally, Breastfeeding Network also offers online antenatal sessions to help prepare parents for breastfeeding, and they happen monthly. As well as the face-to-face groups, the National Breastfeeding Helpline is available 365 days a year and 24/7. So if it's out of hours, if it's evenings or weekends, there's always breastfeeding support available. And that's run by the Breastfeeding Network and the Association of Breastfeeding Mothers. So the new kid on the block when it comes to breastfeeding support, as well as lots of other supports, is our early years app, our GGC early years app. So that's called Happy Healthy Tots. And if you are working with families, then I would ask you to encourage families to use this and to download the app. It's full of a wealth of information on all sorts of things, but including lots of information, useful links, videos, etc. about infant feeding, and also lists any local support from your area. So lastly, I just wanted to touch on vitamin D. So vitamin D is needed to support muscle and bone health. Deficiency of vitamin D can cause rickets, which can cause deformity of the bones or pain in the skeleton. And our main source of vitamin D is sunlight. And I think you'll agree that we don't live in the sunniest country in the world, although this year has been a good one. And actually in Scotland, we only get the sunlight of the correct wavelength for our body to make vitamin D we only get that sunlight between April and September. So out with that time, our body can't produce vitamin D. Some groups are at higher risk of deficiency than others, and that includes pregnant and lactating women and also children under the age of 5. So in terms of supplementation, our recommendations would be that all pregnant and lactating mothers would get a daily 10 microgram supplement throughout the year, and also all children up to the age of 5 as well would have a daily supplement throughout the year. A caveat to this would be just formula-fed babies, if they're having more than 500 millilitres of formula a day, then they wouldn't need a supplement because formula already has vitamin D added. Across GGC, breastfeeding women and children up until their 3rd birthday get free vitamin D, and this should be provided on the postnatal ward. That's where they'd get their first supply of the drops and the tablets, and thereafter they are available from their community pharmacies. And just to note that these recommendations might change because there's a review that's currently ongoing by the Scottish Government looking at what vitamins will be recommended in future. But for the moment, until the end of the year, these are the recommendations. And then this is just some feedback from mums that have used our groups and the telephone support line that we had during COVID. I'll let you read those. Thank you very much.
Thank you, Mary. Unfortunately, our next speaker, Kirsty Haggerty, is unable to join us live for the webinar today, but Kirsty has kindly recorded her presentation to provide us with the insight into the wonderful work she leads on in relation to Henry programme. Please can we play Kirsty's presentation? Thank you, Martin.
Hello everyone. In this section, we will look at NHS Greater Glasgow and Clyde's Child Healthy Weight Plan for children aged 0 to 12 years. As part of the National Child Health Surveillance Screening, children are weighed and measured in Primary 1. This data is captured and reported on yearly. These are the most up-to-date figures for Greater Glasgow and Clyde for 23-24, which were published in December 2024. The percentage of Primary 1 children who are overweight and obese combined is 22.3%. These figures are very similar to the previous year's statistics, and the statistics for Scotland are very comparable to those of Greater Glasgow and Clyde. The percentage of Primary 1 children in Scotland at risk of obesity is recorded and identified according to the Scottish Index of Multiple Deprivation, SIMD. Overweight and obesity rates are more prevalent in areas of deprivation in SIMD 1 and 2. The latest data shows a huge range in SIMD areas regarding the percentage of children in Primary 1 at risk of obesity. SIMD 1 has more than double the percentage of children at risk of obesity than SIMD 5. Childhood overweight and obesity figures spiked during the COVID pandemic. While the total numbers have come down from that peak, in-depth analysis highlights that in the most deprived communities, there has been a rise in the level of children who are obese, and this is concerning. As a result of years of following child health surveillance data, Greater Glasgow and Clyde developed a child healthy weight strategy. This starts at pre-birth with education for parents-to-be. NHS Greater Glasgow and Clyde applies a life course approach to child healthy weight with evidence-based interventions, both universal and targeted, coupled with wraparound support for families. The delivery of child healthy weight programmes for children under 12 years has been challenging with limited impact at population level. NHS Greater Glasgow and Clyde are adopting an evidence-based intervention programme called Henry, which supports families with children aged birth to 12 years. For children aged 0 to 12 years, the focus is on supporting positive lifestyle changes. But for young people aged 12 to 18 years, the focus is more on a calorie deficit diet. Families of children aged 0 to 5 years can access Henry support across NHS Greater Glasgow and Clyde, and families can also access Thrive Under 5 if living within the neighbourhoods identified for the project. Families of children aged 5 to 12 years can access Henry support, and families of children aged over 12 years can access the Way to Go service. So what is Henry? Henry is a holistic approach to tackling child healthy weight and obesity by focusing not only on healthy eating but also the significance of wider influences on children's lifestyles. Parenting styles, emotional well-being and daily family routines all play a part in determining what a child eats and how active they are. The programme brings together information about food and activity for the whole family, emotional well-being and parenting skills into a practical framework for supporting behaviour change. Henry addresses the known risk factors for child obesity and poor health outcomes. Early intervention is crucial, as 1 in 4 children will be overweight by the age of 5. Henry is a programme of training for all staff working with children and families, aiming to take a whole population approach as well as targeting families with greatest need. Henry has the strongest evidence base of any national health and wellbeing provider in the UK. Henry has been extensively evaluated and meets both the NICE and SIGN guidelines. The programme was developed in Leeds in response to an identified gap detailed in Professor Mary Rudolph's report. Since 2009, Leeds have trained their children and families workforce in core Henry messages and offer targeted groups for parents to support a healthy diet and lifestyle for children. The Henry approach incorporates proven models of behaviour change, including family partnership model, strengths-based, solution-focused support and motivational interviewing. Henry Core Training. Staff who attend Henry Core Training will gain an understanding of the Henry approach. The core training elements include raising the issue, working in partnership with parents, supporting change, and creating the conditions for families. Discussions about a healthy lifestyle and choices can be very difficult and emotive subject to discuss, and therefore practitioners will feel more confident when having discussions with families following the core training. Consistent healthy messages are woven through the training, including sleep, oral health, physical activity, emotional health, and many more. Following on from the core training, participants have the option of completing group facilitation training. Group facilitation training is an additional 2-day training. There are 2 options for this training: Healthy Families Right from the Start for families with children aged 0 to 5 years of age, or Healthy Families Growing Up for families of children aged 5 to 12 years of age. On completion of this training, staff can deliver parenting programmes and/or workshops with families. NHS Greater Glasgow and Clyde have commissioned 2 third sector organisations, Peak and Early Years Scotland, to deliver Henry for families across the Health Board area. NHS Greater Glasgow and Clyde aims to train children and family staff to deliver key Henry messages through the delivery of the Health Visiting Universal Pathway and within each trained practitioner's workplace. Families identified as requiring more support will be referred to the 8-week Henry group sessions for children aged 0 to 5 or 5 to 12 years, or workshops delivered by Peak and DYS. Alongside the group sessions are standalone workshops that families can attend for specific parenting topics. NHS Greater Glasgow and Clyde is aiming to emulate the progress evidenced within Leeds to reduce overweight and obesity. Practitioners will have skills, confidence and knowledge to support children and families to eat well and have a healthy weight. Parents and carers will feel better equipped and confident to provide their children with a healthy start, including good nutrition and healthy eating habits. Core training is ongoing and has been extended to all children and family staff in both the statutory sector and relevant third sector organisations. Both Peak and Early Years Scotland know the communities really well and have already relationships with many families. They can offer additional supports to families, which may include, for example, income maximisation, community foods and mental health support. Within NHS Greater Glasgow and Clyde, the health visiting workforce has a learning and development framework in place that includes child healthy weight, growth nutrition and healthy eating messages. NHS Greater Glasgow and Clyde are working in partnership with Early Years Scotland and Peak across all localities. Glasgow North East will be delivered by Peak and the other 7 localities are delivered by Early Years Scotland. Referrals are via the NHS Greater Glasgow and Clyde Child and Young Persons Healthy Weight webpage. Families can self-refer or professionals working with families can refer to the service. Once a referral has been made, EYS or Peak will contact the family directly to discuss the support that can be offered to them. Consent should always be gained prior to any referral being sent. The referral pathway can be accessed from the Children and Young Persons Healthy Weight website. The referral criteria is that families need to live within NHS Greater Glasgow and Clyde with a child or children aged 0 to 12 years and are looking for support with child healthy weight, are looking for increase their confidence in cooking and food preparation, or the benefits of being physically active and trying to promote healthy family routines. Henry went live across NHS Greater Glasgow and Clyde in September 2024, offering the 8-week programmes and workshops for parents and carers. All referrals have been made directly to EYS and Peak via the Child and Young Persons Healthy Weight webpage. From September 2024 to June 2025, the number of referrals are 430. Of these, 91 were professional referrals and 339 were self-referrals, which is really positive to see families referring themselves. Some families report that they were given the information from health, third sector organisations or education staff. We are keen to identify the SIMD areas where families are attending Henry workshops and programmes. 71% of referrals are from SIMD1, which is promising as we know obesity is more prevalent in lower SIMD areas. It is good to see that there are referrals from all SIMD areas. Workshops are being offered across all 8 localities. These workshops run for approximately 2 hours and focus on a specific topic. Families can sign up for as many workshops as they would like to attend. A total of 226 families have attended the workshops from September 24 to June 25. As you can see, the Starting Solids and Healthy Teeth workshops had the most participants. We review the referrals to ascertain what programmes and workshops parents and carers are looking to attend and try to meet their needs. Starting Solid sessions are now going to run more frequently within one of the areas within Greater Glasgow and Clyde, as we have identified a gap which has highlighted the need for these sessions. Health and social care partnerships facilitate their own Starting Solid sessions too, and you will see these advertised across local networks. These are offered in communities face-to-face and online. They are led by health improvement staff in partnership with community dietetics, Child Smile staff, community chefs and community partners. The NHS Greater Glasgow and Clyde website also has a range of resources including videos to support the Starting Solid stage for families. Here are some useful information links for you. These can be easily shared with parents and carers. If you are looking for any further information regarding Henry training or programmes for parents, please contact kirsty.haggerty@nhs.scot. Thank you.
Many thanks to Kirsty for her recorded presentation. I would like to remind everyone that they can pop any questions into the Q&A function at any time during the presentations and we'll pick these up at the end of the session. I would now like to welcome our next 3 speakers who will provide an update on the Thrive Under 5 programme within Glasgow, Alex Durer, Lucy Sewell and Margaret Roberts. Thank you.
Thanks very much, Lorna. Good afternoon, everyone. My name's Alex Shurey. I'm a Health Improvement Senior for the Thrive Under 5 project based in the Northwest Health Improvement team. In this presentation, you will hear an overview of the Thrive Under 5 project in Glasgow. In Glasgow, the Thrive Under 5 project has a health improvement lead and 3 part-time health improvement seniors, 1 per locality, who you will hear from during this presentation. Thrive Under 5 is a pre-5 early intervention project that's been operating in Glasgow since 2021, funded by the Scottish Government. Thrive Under 5 supports families at risk of diet-related health inequalities and provides a package of holistic support to meet family needs and to achieve a healthy lifestyle. Thrive Under 5 is also run in Inverclyde, Renfrewshire and East Renfrewshire. The delivery models have varied in accordance with area needs. The main essence of Thrive Under 5 is the same in each area, helping families with children under 5 with healthy lifestyle activities and resources, enhancing cooking skills and education, providing healthy food in communities, increasing access to fruit and vegetables, and signposting to help in the community, including money advice. The project also helps families to ensure their families have good nutrition and helps to promote healthy eating habits. In terms of funding, from the 1st of April 2024, the Thrive Under 5 project in Glasgow became part of the Whole Family Support through General Practice programme. Thrive Under 5 is now funded up until March end 2026. This involves holistic support for families within 12 GP deep end practices in the city. That's 4 in the northwest, 5 in the northeast, and 3 in the south. And a list of the GP practices being covered will be included on the next slide. There are 7 neighbourhoods that cover the 12 GP practices. The Whole Family Wellbeing Funded Glasgow neighbourhoods are Pollock, Govan, Bridgeton, Easterhouse, Parkhead, Drumchapel and Postle Park. There are wider Thrive Under 5 community sports on offer. Sorry, Martin, if we could just be on the previous slide, thanks. There are wider Thrive Under 5 community sports on offer for families from these neighbourhoods, available for those out with the GP practices that we're going to be listed on the next slide. These supports can include Thrive Under 5 meal packs, increased pantry supports for those suffering food poverty, and the Alexandra Rose voucher scheme, which we'll go on to speak about in this presentation. Next slide, please. Thanks. This is a list of the 12 GP practices operating within the Glasgow model and the allocated Thrive Under 5 senior. This will be available once the presentation is distributed. I will now hand over to my colleague Lucy Sewell to discuss Thrive Under 5 criteria and Thrive Under 5 enhanced supports for families.
Thanks, Alex. I'm just going to give a brief overview of the enhanced supports we have on offer, as well as the referral pathway. So families would need to be a patient at one of the 12 GP practices, which were outlined in the previous slide, and they need to have at least 1 child under the age of 12, which is a recent change from a child under 5, and that's just been in response to need coming through. A family would also need to meet one of the risk factors for poverty, which are outlined in the slide there. So we have lone parent family, a family that includes a disabled adult or child, a larger family, so 3+ children, minority ethnic family, a family where a child is under 1 year old, and lastly, a family where the mother is under 25 years of age. And just to add that families, can be referred up to a maximum of 3 times, and exceptions are considered on a case-by-case basis. I'm just going to now go on to outline some of the supports that we have on offer for families. So we have an 8-week supply of meal packs with a recipe, and that is provided by Scottish Pantry Network, where a family would be given an allocated time slot to collect a meal pack from one of the local pantries on a weekly basis. And all meal packs are vegetarian, and this has been live since July. So we also have free local pantry memberships and 12 free shops for families. So currently we have 7 pantries involved in the project, and we'll have 8 when Govan Pantry opens soon. And as an interim measure, families aligned to the Main Street practice in Bridgeton are being offered 2 £20 Aldi vouchers to purchase essential food items. We also have a £20 voucher for families to purchase basic cooking equipment at the local supermarket, and if a family has 3 or more children, they would be entitled to a £40 voucher. And it's just to say that both of those elements have been running since February. And lastly, Martin. It was just to say that a how-to guide has also been created to help families, family wellbeing workers through the process of how to refer for each of those elements. So I'm now just going to pass over to my colleague Margaret, who's going to go over some of the external partnerships that we have involved with the project.
Thanks very much for that, Lucy. As Alex and Lucy's just explained, the provisions that are in place for the deep end practices, I'm going to talk about the external partnerships that we have within our community setting. So first of all, we provide meal packs in the community, as Lucy highlighted earlier, or Alex had highlighted earlier. It's the Scottish Pantry Network that provides, or who have been commissioned to provide the meal packs for our families. So there'll be additional meal packs provided to the Henry groups and workshops, and for groups running in the Thrive Under 5 communities. There'll be meal packs going out to family support organisations across the 7 communities that Alex had highlighted earlier, and also for those being funded by the Whole Family Wellbeing Community Grant Fund. And there'll be meal packs available for community events such as Challenge Poverty Week, as an example. And we do have several events that run throughout the year, so they will be considered for that also. Next slide, please, Martin. So another external partnership, we're delighted to be working in partnership with Nourish Scotland, who ran a pilot session on the Yes to Veg programme. So they work with the kind of a pre-5 intervention with some of our early years establishments. 8 nurseries have participated, and 3 of them are taking place this month. Weekly vegetable delivery to all the nurseries who are involved for 4 weeks. So there are 2 types of organic vegetables, so the children can learn in various ways about different vegetables. And it's also been evaluated by one of Ada Garcia's master's students from Glasgow University. So how does Yes to Veg work? It's a food systems approach. It's sensory play and exposure to veg. So it's not just a kind of a boring lesson. They do really fun and creative things. You know, they have a vegetable corner, they sing about them, they paint with them, they've learned how they grow, they get to sample them. Nursery staff are also involved in that, of course, parent and carer engagement, which is so important, and focusing food energy for focusing food agency for children. Next slide, please, Martin. So the Alexandra Rose Charity is another external partnership. So through the distribution of Alexandra Rose vouchers, the mission is to provide families who are in low incomes access to fruit and vegetables on a weekly basis. The way that runs is pregnant women can tap into this as well, and up until a child is 5 years old. And the fruit and veg is provided for the full family. It's not just for that child. So if there may be 5 children in that family, fruit and veg will be provided for everyone, including the parents. It's managed and distributed by some of our community-based third sector projects, and our local retailers as well. And a lot of their third sector organisations have identified the families and already have established relationships with the families, which is important. And provision of, as part of the Thrive Under 5, is taking place in Rocasey, Drumchapel and Govan. That's the 3 areas that's currently being provided within, and 105 families are currently benefiting from that weekly, which means there's 193 children with an average family spend of £8.16 per week. Next slide, please, Martin. And this is just a bit of a testimonial, a bit of feedback from one of the parents who are in receipt of the Alexandra Rose vouchers, just kind of a stipulating that the Rose vouchers are changing what they eat, and their kids absolutely love eating fruit and veg, which is very warming to hear. They're getting through a lot of fruit and veg, and without the vouchers, they would be eating less fruit and veg, especially items like aubergines and carrots, and they eat things that they otherwise couldn't. Thank you.
Thank you, Alex, Lucy and Margaret. So transitioning now into our Younger People's Programme, I would like to introduce our next speaker, Lorna McDougall. Thank you.
Thank you, Lorna. Hi, my name is Lorna McDougall and I coordinate the Weight Management Way to Go programme across NHSGGC. Way to Go is a Scottish Government funded adolescent weight management programme for NHS Greater Glasgow and Clyde. Way to Go forms part of the vision and delivery plan for the Scottish Government targeting young people aged 12 to 18 years. Way to Go provides a focus to improving poor diet and aiming to reduce risk factors such as developing type 2 diabetes and hypertension in young people who are overweight and obese. Way to Go encompasses the Scottish Government's vision where everyone eats well and has a healthy weight. Way to Go is part of the life course approach for NHSGGC and offers nurse-led support for up to 24 weeks. It also provides wraparound support for young people with complex issues and needs or long-term conditions. So who is eligible for Way to Go? It is for 12 to 18-year-olds. We do have a transition pathway to adult weight management support for those turning 18. If your BMI is greater than 25, for those that are not pregnant, and the Way to Go nurse carries out a mental health and wellbeing assessment. The programme uses Core 10 and SCOFF screening tools to assess mental health and identify any underlying eating disorders or concerns. We also have access to counselling support, although there are waiting lists for this. Way to Go has two age-related programmes. For the 12 to 15-year-olds, they get up to 24 weeks of support one-to-one with the Way to Go nurse, and have weekly topics which can include food labelling, portion sizes, sleep and screen time use. Parent or carer or guardian should accompany the young person in this age category to their appointments, which also encourages a family approach. For the 16 to 18-year-olds, they get weekly free support from commercial weight management and one-to-one appointments with the Way to Go nurse at key intervals. And both programmes offer advice on healthy swaps and goal setting for exercise and healthy eating. So how do I refer to Way to Go? It offers support for young people in NHSGGC, which includes Glasgow City, Inverclyde, Renfrewshire, East Renfrewshire, East Dunbartonshire and West Dunbartonshire. There are a total of 19 venues across the whole of the NHSGGC, and the Glasgow City evening venues are hosted within the Youth Health Service. You can refer by phoning our contact number, which is 0141 451 2727, and business support will take the referral, which can be a self-referral or from others such as education, third sector, primary care, acute care, and GPs can refer through using the Sky Gateway. Or please visit our website where you can find the expression of interest form. This can be filled out and the service will contact the young person. For all referrals, the young person must consent to being referred to Way to Go. Lastly, I'll leave you with a short video which is one of our young people, Maria, who successfully completed the Way to Go programme.
Well, what made me go into it was because I got referred to it and because of like my weight, and I was having a couple of stomach problems, so I got referred to go to the Way to Go programme. The support there really helps because rather than just jumping into it, you go to someone and you're talking through it, and then you're like being set off for the rest of the week to prepare and then to do it. I was hopeful that I would lose the weight and become the way I want to be. I want to be a lot healthier, and I want to look at myself and have more body confidence and not let my anxiety take over, and be proud of who I am. Yes, my family's on board. Me and my mum and my dad are doing it together. You know, I'm looking at myself in a different way, and I'm thinking about the positive thoughts now and saying, well, if I do bad like this week, for example, then I know how to do better. The one thing I have mostly stuck to is instead of the sweets at night, I've been eating fruit salads, and that is just really good, and it's been making me stick to it because it's a lot more tastier than what chocolate is.
Thank you, Lorna. Moving on, to provide us with an update on the NHSGGC programmes for adult healthy weight and physical activity, I would like to welcome Claire O'Kane. Thank you.
Thank you, Lorna. As we've heard from previous speakers, NHS Greater Glasgow and Clyde offers excellent services supporting healthy weight from birth to adolescence. I'll focus on our adult programmes, helping patients achieve and maintain a healthy weight and lifestyle. The Greater Glasgow and Clyde Weight Management Service is made up of two service arms, the Specialist Weight Management Service and the Community Weight Management Service, and I will give you an overview of them both in this presentation. We provide a number of self-management resources for patients to access, and I will describe some of these shortly. I'll also cover our physical activity services which complement our weight management programmes. This slide shows how patients and health professionals can access the weight management service. As you can see, there are a number of pathways to access the service, and all referrals are received by the Weight Management Hub. Access to the weight management service is based on clinical need, BMI and a range of health conditions. I would like to emphasise that patients who are overweight and have diabetes, heart disease or have had a stroke can self-refer to the service online or by contacting the Weight Management Hub directly. Health professionals working in primary care can refer through Sky Gateway, and those working in acute settings can refer through Track Care. We also have the Type 2 Diabetes Hub. Patients newly diagnosed with Type 2 diabetes or gestational diabetes will be contacted directly by the Type 2 Hub to offer support and resources for managing their conditions. This includes access to Control It Plus, the structured Type 2 diabetes education programme. Eligible patients will also be offered a referral to our weight management service. More information on the diabetes pathways and referral information and resources can be accessed via the link on this slide. I have also added a link to the full referral criteria and guidance for the weight management service at the bottom of this slide. All patients referred to the service are triaged by our Weight Management Hub. Patients are then given details on how to access Tier 1, 2 or Tier 3 of the service, depending on their BMI and health conditions. Generally, patients with a lower BMI and less complex health conditions are triaged to our Type 2 community service, and those with a higher BMI and more complex health conditions are triaged to the Tier 3 specialist service. We have an exceptions pathway in place which allows patients to move between tiers if necessary. A lower BMI threshold applies to South Asian, Chinese, Black and Middle Eastern patients. Our physical activity programmes, Live Active, Vitality and our free health walks provide wraparound lifestyle support for patients. I have included a link to the Get Active website which provides more information on these programmes. For patients who would like to manage weight loss on their own, we have a number of self-management resources available. The Eat Well, Feel Great, Lose Weight resource will help patients get started and build the foundations for successful, effective weight loss. This is available to order on the Public Health Resource Library or can be downloaded from the NHSGGC Weight Management website. We have recently refreshed the NHS Inform Weight Loss page with advice, tips and sustainable strategies for weight loss, and more information as to where to find further support locally. As previously mentioned, our physical activity programmes provide a number of opportunities for patients to become more active, including the free health walks. Currently, we have over 27,000 attendances at these walking groups, and last year we had 494 new walkers join the programme. We also trained 34 new walk leaders. Now, to give you a bit more information about the Tier 2 Community Weight Management Service. The Community Weight Management Service is delivered in partnership with Weight Watchers and Slimming World. We have over 460 face-to-face and virtual sessions available from Monday to Saturday, daytime and evening across the health board area. This ensures good geographical spread and accessibility for patients. Patients receive a free 12-week membership with either Weight Watchers or Slimming World with access to workshops, tools and resources. Those attending 10 or more sessions and who lose at least 5% of their body weight will receive a further free 12 weeks. Many patients are now in their 7th or 8th 12-week membership, showing successful sustained weight loss. The Tier 3 Specialist Weight Management Service is a structured programme led by a multidisciplinary team of dietitians, physiotherapists and psychologists. There is a focus on diet, activity and behaviour change, underpinned by psychological support. Every patient undergoes an initial assessment to tailor their treatment plan. I would like to share some of our patient success from the Community Weight Management Service as shown on this slide. Referrals mainly come from primary care, and our referral data shows a clear trend. A steady rise before COVID, a natural dip during the pandemic, and now a sharp increase. In fact, referrals to the service have doubled in the past year. This reflects the wider reality of rising obesity rates. 2/3 of our patients complete the programme, and of those, 60% achieve at least 5% weight loss. Many then continue with additional 12-week memberships, highlighting the importance of providing ongoing support beyond the initial 12 weeks. I've provided an overview of our services, but the most powerful stories come from our patients themselves and what this journey has meant to them. To truly understand the impact of our services, our patients share their personal experiences and how their weight loss journey has positively transformed their lives and their families. Patients who have engaged in the weight management service have achieved meaningful lifestyle changes and improved control of health conditions such as type 2 diabetes, arthritis, and blood pressure. This is through their own commitment and perseverance to improve their own health and well-being. Before I hand over to one of our patients to share their personal experience, here are some links and a QR code that will take you to all the information I've covered today. It's been a pleasure highlighting the support we offer patients in GGC as they embark on and sustain their weight management journey. Now, to bring this to life, I'd like to introduce you to Chris, a patient who has kindly agreed to share his personal journey with us. Thank you.
Before I joined Live Active, I was about 23.5 stone. I remember walking up the steps to my house. I just remember crawling up them, and I was thinking, this is it, like there's a point of no return, and if I didn't do something, then I would die this way. I wouldn't ever want to go out. I just was a hermit that spent my life in the house. There's a general lack of self-confidence. Coming to a facility where there's a Live Active instructor that's asking, hey, how are you? How you doing? Like, how have you been in the last few weeks? How your eating been type thing. So I'm accountable, I'm answerable to that. There's a gym instructor that's saying, have you managed to do the cross trainer yet? Have you managed to do 10 minutes on that? It felt positive, it felt great on the start of it, but it's like I still had to find my feet a bit. I had lost 10 stone, right? I didn't walk into the office and say to that person, I want to lose 10 stone. It was, I want to lose a wee bit of weight. And every month or every week, that's what would happen. And eventually, it led to that. Because if you'd have told me right at the start that that's what the total weight would have been, there's not a chance that I'd be like, no, that's not possible. Why? And that would have put me off. Because you'd be like, that's just such a stupid number. Like, I'm never going to get that. But that isn't what happened. It was just a casual conversation about, here, let's try, as I said, it's food substitution. Let's try the physical activity things. Let's try getting you moving a bit more, and let's see where we end up with it. And bit by bit, it would become clearer. They gave me an understanding that it wasn't just about losing weight, that it was becoming part of my life. You keep going with this, you maintain it, you know, like it's part of your life now. And aye, that was a big thing. Commitment is to get you started, okay, the commitment is to come, and the consistency is to just keep coming. Really, they're the two things. If you can have those two things, you will make changes in your life, you will achieve what it is that you're looking to achieve.
Thank you, Claire, and thank you for sharing Chrissy's wonderful journey with us. To provide you with an overview of the NHSGGC wraparound support, I would now like to introduce Carol Beckwith. Thank you.
So thank you. That's been amazing this morning, and trying to follow that has been it's quite the challenge to try and make sense in some way of what I've got to say. But I will give you an overview. A lot of what we've said so far has been around wraparound support, whole systems approaches, holistic support. So I hope some of that will come into view a little bit more easily. It'll make a bit more sense of what I'm about to tell you. So Greater Glasgow and Clyde developed a 2-year community food framework that facilitates a population-wide approach to better health through a number of things. And that was improving or providing access to healthy foods, improving knowledge and understanding of how food choices can support better health and well-being, introducing and improving practical food preparation skills, and introducing pathways to employment through REHIS training. It also supported an approach which delivered small grants to local organisations, and what that did was it allowed locality teams to be community-led in what programmes they were delivering and how they were delivering them against the framework priorities. They created opportunities, these grants, to support local grassroots organisations to deliver in their own communities, often through things like events and workshops. And what they did also was to make growing projects accessible. So for people that wanted to get out of doors a little bit and to take part in something maybe they'd not done before, encouraging people and families, individuals and families, to increase their knowledge around growing healthy food and understanding where it comes from through participation and informal education. The framework provided training, as I've mentioned, equipping local people with industry standard and accredited qualifications, and that's the part that creates pathways to employment. And although this formal training is really significant, it's not restricted just to formal learning, but working with local partners, we've provided opportunities for individuals and families to increase their own knowledge, skills and confidence around food, nutrition and well-being. So who's it for, this framework? Well, we've heard a lot about wraparound support and different elements of programmes that are not just one thing, but are lots of different things. It provides a suite of activities to complement and wrap around the Healthy Weight programmes that we've heard all about this morning. In particular, it provides support for families who struggle with food insecurity, who struggle with basic cooking skills, who struggle to access fresh fruit and vegetables, and we've heard a bit about that. And it also provides support to families with children who find it challenging just simply to provide and maintain a healthy diet. But it also provides post-diagnostic support for persons newly diagnosed with type 2 diabetes, and that in itself encourages self-management of the condition through healthy eating and preparation of food. Elements of the framework are also aimed at BME populations who are at greater risk of type 2 diabetes, and also the organisations who are engaged within these communities and who are often in a position to be influential. They can have a significant input into what food is purchased, prepared and consumed. So this was a handy little diagram that I borrowed from the Population Health Framework 2025 to 2035. And as they have indicated in the report, it's also influenced by the King's Fund Population Health Pillars and the Institute of Health Equity's 8 Marmot Principles. So it's a really helpful diagram, and it ties absolutely right in to the Greater Glasgow and Clyde Community Food Framework. It's prevention focused. It harnesses opportunities for early intervention via programmes that focus on food, health and physical activity. It addresses social and economic factors by identifying and supporting those who experience food insecurity. It supports a places and communities approach by working in close partnership with the third sector to deliver within communities who are at most disadvantage. It enables healthy living by providing the knowledge and the skills that build the confidence that help people to manage their own health and their well-being through healthy food choices. It facilitates equitable access to health and care by working with and through partners in health and in the third sector to identify those who need the most help to achieve better health and well-being. And this is just a little flowchart just to let you see how the framework provides the breadth of wraparound support, and it kind of ties a little bit in with what Claire's diagram was illustrating, and how it works in tandem with those healthy weight programmes. So as all my colleagues have said, it covers adult weight management, type 2 diabetes, all of the child and young person's healthy weight programmes, and it covers also BME work within specific communities. With its particular focus on skills development and food literacy, the framework allows us to weave what we do, each of the elements, through all the programmes that our programme manager leads on in the board. And this is just a little snapshot of how the framework has reached the intended recipients in the last year to 18 months. But there are many case studies which we've received from our locality partners in health improvement that demonstrate the real tangible impact that it's had on the lives of people who live in our most disenfranchised communities. In particular, the Small Grants programme has evaluated very positively, and with the added value that the programme of training has brought, many local organisations are now equipped to deliver food work and education within their own communities independently of us. And you really couldn't ask for a better set of outcomes of that. And when we talk about capacity building, it really hinges on that particular strand. So what are the next steps for us? We're kind of at a pivot point with the current climate being full of challenges, not least of which is the cuts to funding and the significant pressures that they've created. How do we proceed through our next planning phase? But it will be no surprise when I say we need to innovate. We need to look at what we should keep doing, what we should stop doing. We need to also identify the gaps and opportunities that are before us. And essentially, we need to be able to do more with less. Sorry, guys. that's what it boils down to. We need to collaborate. We need to work better and smarter across our teams, but also across third sector organisations in order to maximise the impact of what we do. We need to build capacity in the ways that we've heard so much about this morning by harnessing the assets that we already have. So, for example, a product of the training has been community chefs and champions, but also the anchor organisation who are desperate to deliver the best work for the people that they serve, and who are already working within their existing community settings, programmes and projects. It is undeniably challenging to persuade people to change behaviours. I think we would all agree. To change their behaviours and lifestyles at any stage across the life course. But it's doubly so when there are gaps in understanding the obesogenic environment in which we live. However, if we adopt a whole systems approach across the whole food environment or the whole food system, we do foster a spirit of collaboration amongst all of our stakeholders. We start to build a shared understanding of the complex challenges that we all face. And we start to develop integrated, sustainable solutions. We can avoid unintended consequences by considering how the different parts of our systems are connected. And this approach leads to a more effective, community-centred set of outcomes by empowering local involvement, leveraging collective strengths, and ultimately resulting in a more efficient use of the resources that we do have that bring and create the conditions to bring lasting change. The framework does in fact reach beyond the immediate populations that I've mentioned and serves the whole of the board area with a suite of quality assured resources that Claire has already alluded to. These are available online to anyone who wants to access them, and again the referral criteria are there. The supporting resources include a range of recipes and cook-along videos that have been developed in partnership with dietetics and public health nutrition. And you will notice my deliberate error in the slide that talked about the 4 points: innovation, collaboration, etc. There was the Good Food Nation plan, and this is where this comes in. Why should we concern ourselves with community food work? How does it link to our strategic direction and what we do locally? As I've already mentioned, we're weaving this work through all of our Healthy Weight programmes because we know that when people are equipped with the tools for success, for example, knowledge, resources, confidence and skills, they're more likely to make and sustain lasting behaviour change. But as well as that, the enactment of Section 10 of the National Good Food Nation Plan that Lorna mentioned at the beginning, and it's been mentioned a couple of times since, is that every relevant authority must produce a food plan against the 6 objectives in this slide. Everyone should be able to eat well in Scotland. We should have a sustainable food system, which should support better health and well-being. Our food and drinks sector should thrive without having adverse effects on our health, and our communities should be able to shape that system and culture, enabling Scotland to make a contribution towards transforming local and global food systems. And the evidence for a whole systems approach is compelling. We know that being community-centred is key to engaging with our communities, but also key to sustaining that engagement longer term. And so finally, in Glasgow, when I say Glasgow, I mean the whole of the board, we're committed to reviewing our framework that we've delivered up to this point to ensure that it remains or becomes both evidence-based and robust enough for 2026 and beyond. Thank you.
Thank you, Carol. That really brought everything together really well. So that's us come to the end of our presentations now. I'm aware there's been a lot of information for everyone to take in today at the webinar, and thank you for being so patient and watching and listening and allowing the whole team to come together today to tell you and share with you what we do. And I think having pulled this webinar together, we've all really realised the sheer volume that we are able to support through that life course to our citizens within GGC. I would now like to invite the panel to turn their cameras on, please, and join us for the Q&A session. I'd also like to invite Siobhan Boyle, the co-chair today, to the panel to support this section of the agenda. Thank you.
Thank you. So there's been questions that have been posted in the chat today, and we've been picking them up as we've been going along. So we'll bring one of those questions in that's been posted, and also some other questions that have come through today. So the first question I would like to direct to Alex from the Thrive Under 5 project. Alex, are there plans to roll out Thrive Under 5 to other areas?
Thanks, Siobhan. In terms of that question, we are keen to further build and strengthen the Thrive Under 5 approach as our evaluation has shown the benefits that the support brings to families. We mentioned earlier about Thrive Under 5 and it's funded by the Scottish Government initially as a small-scale pilot, a whole systems approach that supported healthier nutrition for children under 5, but funding for all areas before proof and escalation impacts could be tested. So therefore, we are looking to source external funding to build on a promising start towards a programme of activity that is more viable and impactful at scale, rooted in reducing food insecurity and promoting food health in the early years. And we do recognise that this will take time to embed Thrive Under 5 in medium and public sector financial plans between local authorities and the NHS. Hope that answers your question.
Thanks for that, Alex. Thank you. So I'm just going to invite Lorna in, Lorna McDougall, with regards to the Way to Go service and the programme itself. So in relation to the 2 age-related programmes, how do they work?
Hi, thanks Siobhan, and good question. So the programmes, kind of as I covered on the slides, are split into it's 12 to 15 years of age. So they get support for up to 24 weeks. There is 19 venues across the whole of the NHSGGC. So depending on the area, there should be the young person lives in, there should be somewhere that is reasonably close by that they can attend. For the 12 to 15-year-olds, they will get an offer of a weekly appointment with the nurse. And for the 16 to 18-year-olds, they get support from the commercial weight management in the community, and they get a weekly offer of that for up to 24 weeks, and they get the nurse at key intervals support at the venues, and there is a list of venues on the Way to Go website, which might be quite useful just if anyone has someone in mind that they want to refer, whether they're 12 right through to 18.
Great. And Lorna, are the appointments available during the day as well as in the evening?
So that's a really good question as well. With regards to the appointments, they're offered in the evenings at multiple locations across Glasgow City, because the venues are actually hosted within the Youth Health Service. The daytime appointments, we do have one Glasgow venue, which is at Castlemilk Health Centre, but otherwise the daytime appointments are actually hosted in the Eastern Bartonshire, Renfrewshire, East Renfrewshire, Western Bartonshire and Inverclyde areas.
Excellent, thank you. It was just to pick up as well, there was a note that was in the chat from one of our attendees today, and they were asking if you could go along to your GP as well as go directly to access one of the programmes for a child who is 12 and looking for support. So would that be right? They can go both routes, either of their choice.
Yes, and actually because of the 12 years of age, the parents can also get support through the Henry programme, because they will support up to the age of 12. So there can be a wee bit of parental support that they can get in addition, Way to Go support for the young person, and obviously the GP should they have other health concerns that they want to see a medic for. So absolutely.
Great. Thanks, that's really helpful. Thank you, Lorna. Okay, so just moving across now to our weight management service and physical activity programmes input. So Claire, I'd like to ask you a question. So what if a patient has a preference to go to Weight Watchers over Swimming World? Can they choose where they wish to go to?
Thanks, Siobhan. Yeah, so our weight management hub are always happy to discuss referral options with patients and take individual preferences into account, because quite often we hear that patients have previously attended one or other commercial organisation. Every referral is triaged and the patients are offered one or the other, and primarily that's based on which service is closest to them. And this is because patients are more likely to attend sessions that are convenient. So yeah, however, patients can always talk to the hub staff and exceptions can be made, and they always do their best to meet the needs of that individual. So yeah, it's possible.
Good stuff. Also just to ask, what happens if a patient doesn't complete the 12-week membership or don't meet the 5% weight loss? What happens?
Yeah, so patients do sometimes take a break between 12-week memberships, and this is often due to hospital stays or a flare-up in health conditions, or if they just don't meet the success criteria on that occasion. We do operate an open door policy, so if patients are unable to complete the 12 weeks for reasons beyond their control, just like what I've mentioned, they can be referred into the service at any time, as long as they still meet the eligibility criteria. This approach really supports patients on a long-term weight loss journey, because we find actually on average most patients benefit from 3 to 4 12-week memberships, which usually takes us around about a year to complete to achieve the weight loss that's most beneficial and has the most benefit and impact on their health.
Thank you. Okay, Carol, it's just a question for yourself and the input in relation to the community food framework. What barriers have you encountered in addressing food insecurities, and what approaches have you taken to try and overcome them?
Yeah, all the hard questions today. So I think we probably all know that for people who are experiencing food insecurity or struggle with, you know, things like budgeting for food and knowing what food is healthy to buy and what food is reasonable to expect that they can buy within their means, there can be a lot of stigma or embarrassment around seeking help for that, and other elements of the kind of poverty agenda that we are aware that people struggle with when it comes to the basics in life. So when we've been developing this work and getting the framework operational, a key factor in ensuring that people feel comfortable in accessing the support that we know that they would benefit from is that it's done through organisations that they may well already be engaged with. So, for example, I mentioned the BME communities. So, we are aware that we are not a particularly diverse workforce. We just have to look at our pictures around the table this morning. But actually working in partnership with BME organisations who are embedded and anchored within these communities can make a real difference. And when there are particular barriers, whether they be cultural or gender-based or whatever, these organisations can really get a foot in the door to help with that. Apart from that as well, is once you have got someone engaged with an organisation, they're in a position to then signpost them to some of that other wraparound. So if it's money issues that they have, they can be referred to support with that, and potentially that means referring them to Thrive Under 5 or to Henry and so on. So I think taking that overview of one issue is a much more helpful than taking a polarised view of that issue. So, yeah.
Yeah, that's really helpful, Carol. Just explores that whole kind of benefit of the holistic support and the difference that makes. Okay, so I'll just bring Mari in now, just to ask Mari, and thank you for your presentation earlier. In relation to the community support that's available for breastfeeding, how do people in communities find out about where they can access that in Greater Glasgow and Clyde?
Yeah, so I mentioned the app. That's a really good resource. So all the community support is listed on the app, and also on the Breastfeeding Network website. But ideally, families would be signposted to all the community supports via their health visitor or family nurse. But yeah, the Breastfeeding Network website is a good place to look, and the app as well.
Excellent. Thank you. I think we've covered most of the questions that were brought forward to us and through the chat function. So over to you now, Lorna.
Just wanted to thank everyone for attending today. You'll be able to find the recordings from previous webinars by the Glasgow Food Policy Partnership on their website. If you want to find out more about their work and the work of their partners and the work that we do, you can subscribe to their newsletter. If you've got any other questions that you want to put to the speakers, we've provided our contact details today, and we would welcome you getting in touch with us to get clarity around anything that you want to discuss. I also want to make a special thank you to Martin Dale, who's in the background today. And I think that's from all of the speakers today, just to say thank you, Martin. You've made the before and the during kind of experience today so much easier. So yes, thank you very much. There you go, he's joined us. Hi, Martin. I would also like to thank the Glasgow Centre for Population Health Communications team for helping put the event on today as well. Finally, I'd like to say a big, huge thank you to all the speakers today. It's been a really informative, and I think all the links and sharing it all as that journey that someone can take and transition into all the different programmes is so important to understand that we're not programmes that sit in isolation, but we are a full flowing journey from birth right through. And just say that I hope you all enjoy the rest of your day. Thank you very much.